Repeated bouts of acute pancreatitis can progress to chronic pancreatitis. With each bout, there's potential for ductal dilatation and damage to the pancreatic tissue. As part of the subsequent healing process, pancreatic stellate cells lay down fibrotic tissue, which causes narrowing or stenosis of the ducts, as well as acinar cell atrophy. In addition, in certain conditions like alcoholic acute pancreatitis, calcium deposits of various sizes can accumulate on the plugs that form the ducts. This gradual process of healthy pancreatic tissue getting replaced by misshapen ducts, fibrosis, and calcium deposits is chronic pancreatitis. Early diagnosis of chronic pancreatitis is challenging. People with chronic pancreatitis often have continuous or intense intermittent abdominal pain in the epigastric region that sometimes radiates to the back. This pain may or may not be linked to eating meals, and it tends to last for at least several hours. Even though elevated lipase and amylase levels are suggestive of acute pancreatitis, in chronic pancreatitis there may not be enough healthy pancreatic tissue to make those enzymes, so they may or may not be elevated. Oftentimes the diagnosis relies on imaging studies that can identify the structural changes to the pancreas. For example, abdominal X-rays and CT scans might show calcification of the pancreas. The pancreatic ducts themselves can be visualized with endoscopic retrograde cholangiopancreatography, or ERCP, which is a technique where an endoscope is passed down through the mouth to the duodenum, where it's used to deliver contrast medium to the pancreatic ducts. Subsequent fluoroscopy contrast studies can reveal structural changes to the pancreatic ductal system. For example, the duct might take on a chain of lakes pattern due to alternating stenosis and dilation of the ducts. An alternative technique that can also evaluate the pancreatic ductal systems is magnetic resonance cholangiopancreatography, or MRCP. As the acinar cells become impaired, they produce fewer pancreatic digestive enzymes, which results in pancreatic insufficiency. These individuals can have trouble absorbing foods and dietary fats, often lose weight, and even develop a deficiency in vitamins A, D, E, and K, which are fat-soluble vitamins. Without digestive enzymes, fat might pass right through the intestines undigested, leading to greasy and smelly stools, called steatorrhea. A long-term consequence of chronic pancreatitis is the development of diabetes mellitus, which happens as the recurrent inflammation begins to damage the alpha and beta cells of the pancreas. In addition, some individuals develop pancreatic pseudocysts, which in the context of chronic pancreatitis is often the result of ductal obstruction, which increases pressure, induces leakage, and results in accumulation of parapancreatic fluid in fibrous granulation tissue, either within or just outside the pancreas. Not surprisingly, repeated inflammation can also give rise to pancreatic cancer on rare occasions. Treatment of chronic pancreatitis involves controlling pain and trying to control the risk factors, things like drinking less alcohol, eating less meat, and reducing obesity. Individuals with pancreatic insufficiency might require replacement digestive enzymes and nutritional supplements, and those with diabetes might need insulin replacement therapy. Alright, as a quick recap, chronic pancreatitis happens when irreversible changes to the pancreatic structure, like fibrosis, atrophy, and calcification, begin to decrease the functions of the organ. Eventually, this leads to pancreatic insufficiency, which makes it difficult to digest food, as well as the destruction of alpha and beta cells, which makes it difficult to produce hormones like insulin.